Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here for the Michigan Business Beat, and we are on the island. That's exactly right, Mackinac. We are in the Grand Hotel because this is where the Detroit Regional Chamber of Commerce has their annual policy conference. And who is more in the middle of all this than the Michigan Michigan Health and Hospital Association? It originally was the Michigan
It was the Michigan
Hospital Association.
healthcare reform that we thought maybe we would be greater, there would be more to the story. And so they changed the name and it's never gone back.
But it's still MHS.
It's still MHA.
So I can remember that. Okay, so Laura Appel, Senior Vice President, and we want to talk about something that off air I found pretty astounding, because one of our biggest challenges in all industries is talent. It's people.
Talent, absolutely. And MHA, on behalf of its members and our members, of course, which are all of the hospitals in Michigan, have been focused like a laser on retaining and growing workforce. And we did a survey of our members in 2023, and we repeated that survey in 2024. And what we found is in the last 12 months, our members have hired 60,000 people.
60,000.
An amazing statistic, 60,000 people.
Oh, where did they get? Is there some place manufacturing people?
Well, we've been trying like the Dickens. Our organization has a My Hospital Careers campaign that's online that we would love for people to visit. But we are looking for people wherever we can get them. And we have a career path for folks once they start working in the hospital. We have 19,000 more vacancies. So I would love for folks to reach out and, take a look at what might be available online. We've reduced our number of nursing vacancies. I know this has been a very big concern among everyone, including our nurses. We don't have enough nurses. We reduced that vacancy rate by 44%. That was very good news. Hospitals employ about 217,000 people in this state. But I think, going back to the hiring, we are looking for growing our population, growing our economy, making sure our economy is strong. And I just want people to understand, we really are part of that. 60,000 jobs, I think, tells you that.
Oh, a big part. And you are a growth industry. There's no doubt about that. So you have to be fed.
Well, we are, people are aging out, and so we need to replace folks, and we need different types of people inside the hospital. There's a job classification called patient care tech, and those folks do a lot of things to assist registered nurses so that the nurses can work at the top of their license and the patient care tech can take care of the other needs the patients have that are not necessarily clinical. So there are different job classifications that we're trying to fill, but we have, like I said, 19,000 vacancies. So despite hiring thousands and thousands of folks, we still need more, and we're working to develop that workforce. The legislature helped us a lot with some funding a few years ago to help us retain the workforce that we have, but we have a lot of work ahead of us as well.
Well, so you got halfway there actually with 19,000, and you need 20 more. But let's talk a little bit about where these people are coming from. And I know you work closely with community colleges, the universities, et cetera, who turn these folks out.
Yeah. If I could make a plug for a program called Michigan Reconnect. Reconnect is available to anyone who's 21 years and older who hasn't completed a community college degree. You can also use that program for a certificate. So if you're thinking, wow, if I could get a little bit of training, maybe I could get a much better wage. You're absolutely right. You could become a lab technician, a patient care, a person who prepares sterile instruments, a person who does phlebotomy. All of those things can be learned at the community college, and Reconnect will help you with that tuition. You have to go to community college for 2 years to get one, and those are well-paying jobs. And I promise you that folks want you to work for them in those roles.
All right. So I know that's not the only issue that you have. What would be second place?
Second place is probably access to behavioral and mental health services. We still struggle with making sure that we have what folks need. We have a dearth of clinical placements, For example, we know of one person in the Upper Peninsula who's a child psychiatrist. One. We used to have zero.
That's a bit of a drive.
That's a bit of a drive for anybody, and we're not sure that that person actually practices. It could be that they maintain that license but are actually retired up there or something. I'm not saying that they are. I'm just saying we can't promise you that. So, we desperately need more outpatient services. Psychiatry especially seems to be a challenge. But then, kids with special needs, well, anybody really, people that have both a developmental disability and a mental illness, it's really, really hard to get services for them. If you ever hear about people waiting in the ED, it's probably one of those special complex cases, and those are especially difficult to solve.
Well, I hadn't thought about it, but probably Simone Biles, as much as anybody, heightened that mental health aspect to it. So, yeah, there's a little bit of work to be done. Hey, Laura Appel, thank you so much for being here.
We appreciate being part of this, and we've had a great conference. And I just want to say one more time, hospitals are anchor institutions. The theme of this conference is bridging the future together, and we are absolutely a bridge to Michigan's workforce.
Well, so good to have you here, and give Brian and everybody back at the ranch our best, would you? Thanks so much. All right. We are going to be right back with more. I'm Chris Holman on the Michigan Business Beat, coming to you from the Detroit Regional Chamber of Commerce annual policy on Mackinac Island. Stay with us.